How would we test for HER2 mutation? So we talked a little bit about this, but I want to double click on this because there are some core concepts which can help you advocate for yourself. When we do next generation sequencing, you might notice that your doctor will offer to do a blood-based test, which means you draw blood the way you do for labs, and that's sent to either a third-party vendor or is then processed in the lab of the university or the hospital system where you're receiving care, and they will do their next generation sequencing. More often than not, it is sent out. So don't be alarmed if your doctor sends it out to a third-party vendor. Now, this can also be done with your tissue. And the tissue is the tissue from the cancer that they biopsied, or maybe that was previously resected. And so typically, you really want to ask that everything is tested. Your blood is tested and the tissue is tested. You want both to be tested to increase the chance of your doctors finding a mutation if there is one. The other thing you want your doctor to do is test for immunohistochemistry. Sometimes the immunohistochemistry can be positive even if you don't have the mutation, because this tests for different things, overexpression versus mutation, like what we discussed previously. There are other techniques that your doctor may use in case there isn't enough tissue, or to try or to bypass um, certain issues that they may have. These are called PCR-based techniques, which your doctor may decide to do, but the most common things are tissue, immunohistochemistry, and next-generation sequencing. And just to reiterate, you want to ask your doctor to please test both your blood and the tissue. Which patients qualify for HER2 mutation testing? Every patient with a diagnosis of metastatic non-small cell lung cancer, irrespective of their histology, adenocarcinoma, or squamous cell carcinoma, qualifies for testing for HER2 mutations. In 2022, the FDA first granted accelerated approval for TDXD for adult patients who have unresectable or metastatic non-small cell lung cancer whose tumors had activating HER2 mutations and had already received prior therapy. More recently, the FDA also approved TDXD for adult patients who had unresectable or metastatic cancer, solid tumors, who had already received prior therapy and there were no other satisfactory treatment options. So you can see over here that there is approval for patients with HER2 whose tumors have HER2 mutations and whose tumors harbor HER2 positivity by IHC, which is why you want to test for both.